Is obesity a disease? The shocking truth about weight and health. Hey there, health seekers. Welcome to the US Health Guide, your friendly spot for real, evidence-based health info. Did you know over 1 billion people worldwide are navigating life with obesity? For ages, we've heard the same old story: just eat less, move more. It was often simplified to a willpower thing, a simple math problem of calories in versus calories out. But what if that story isn't the whole truth? What if obesity is actually a complex, chronic disease? Today, we're diving deep into the science, checking out the real-world factors and exploring what it truly means to call obesity a disease. Get ready to rethink everything you thought you knew about your weight and your well-being. More than just a number, understanding obesity. Our journey to understanding obesity starts with how we define it. You've probably heard of body mass index, or BMI, right? It's a common tool to screen for weight categories, but honestly, it has some big limitations. BMI can't tell the difference between muscle and fat. Hello, bodybuilders. And it definitely doesn't tell us where that fat is hanging out. And that location actually matters a lot. For example, fat around your tummy, think apple shape, can be riskier for your health than fat stored in your hips and thighs. That's why big health organizations like the World Health Organization and the American Medical Association, AMA, are looking beyond just BMI. The AMA, in a huge move, officially called obesity a disease back in 2013, and they stood by that decision again in 2023. The Obesity Medicine Association goes even further, describing it as a chronic, progressive, relapsing, multifactorial, neurobehavioral disease that comes from too much body fat messing with how your body works. This shift towards Adiposity-Based Chronic Disease, or ABCD, is all about getting a super precise, actionable diagnosis, helping us move towards personalized care that really fits you. It's not just about what you eat, the biology of weight. Forget the old calories in, calories out mantra for a sec. Obesity is actually deeply wired into our biology. Think about it. Your genes play a role. Yep, your DNA can influence your risk by up to 70%. This affects how your body processes food, stores fat, and even how it tells you you're hungry or full. Hormones, hormones, hormones. Hormones like leptin, the I'm full signal, ghrelin, the I'm hungry signal, and insulin, which manages blood sugar, are like the conductors of your body's orchestra. In obesity, your body might ignore leptin signals, leaving you feeling hungry even after eating. Ghrelin can get out of whack, making you feel super hungry even when you shouldn't. And insulin resistance is a big reason many people get type 2 diabetes. The vicious cycle. When you gain weight, your body actually gets really good at storing fat and less good at burning it. It's like your body wants to hold on to every bit of energy. This creates a vicious weight gain cycle that makes losing weight and keeping it off feel incredibly tough. Tiny tummy friends, even the bacteria in your gut, your microbiome, are in on the action. They influence your energy, how you store fat, and even inflammation. Wild, right? The domino effect, how weight impacts your whole body. The health effects of obesity are huge and can touch almost every part of your body. It's a major risk factor for heart problems, heart disease, stroke, high blood pressure. Type 2 diabetes. About 90% of people with obesity also develop type 2 diabetes. Certain cancers. Yup, obesity increases your risk for some types of cancer. Achy joints, musculoskeletal issues like osteoarthritis. Breathing issues, like obstructive sleep apnea. And here's something important. There's often a two-way street between obesity and mental health. Feeling down or anxious can sometimes lead to weight gain. And living with obesity can make those feelings even tougher, thanks to things like poor self-image, judgment from others, and even those biological shifts we talked about. Beyond you, the world around us and your weight. It's not just your biology. A complicated mix of environmental and social factors also play a huge role in obesity. Our food world, think about it. Cheap, super-processed, highly marketed foods are everywhere. Plus, many neighborhoods are food deserts, meaning fresh, healthy options are hard to find. It makes healthy eating a real challenge. Sitting more, with more screen time and less physically demanding jobs, we're simply moving less in our daily lives. Stress and sleep. Not getting enough sleep and dealing with chronic stress can mess with your metabolism and make weight gain more likely. Life's big picture. Things like how much money you make, your education, access to good health care, and safe places to be active all seriously impact obesity rates. These aren't just individual choices, they're systemic issues. Feelings and food. Sometimes we use food to cope with stress or anxiety, and cultural ideas about food and body image can add even more layers to the puzzle. Breaking down weight stigma. It's not your fault. Perhaps one of the most damaging things is weight stigma, being judged or discriminated against because of your weight. It's shockingly common, even in healthcare settings, where it can mean you get less quality care or even denied treatments you need. Here's the thing. Stigma doesn't motivate weight loss. It actually harms people, causing stress, making them avoid doctors, and ironically, even leading to disordered eating and weight gain. The constant stress from stigma can also trigger inflammation and stress hormones in your body. Let's bust some common myths. Myth: obesity isn't genetic. Truth: it absolutely can be. Myth: fad diets work long-term. Truth: most people regain weight within 2 years after a fad diet. Myth: you can outrun a bad diet. Truth: what you eat is key for weight management. Myth: healthy foods have no calories. Truth: even healthy foods have calories. Eating too much of anything will still lead to fat storage. The future: hope and action. Classifying obesity as a disease has huge implications. The goal is to improve healthcare access, speed up research, and reduce stigma by changing the story from a moral failing to a complex medical condition. Of course, there are still challenges, especially with insurance coverage for new anti-obesity medications and surgeries. For example, Medicare has historically struggled to cover weight loss drugs, though changes are being proposed. New ways to diagnose, like ABCD, are being suggested to better find those who truly need treatment, moving beyond just BMI. And groups are fighting for fair care and to reduce weight bias in healthcare through initiatives like the Obesity Bill of Rights. Ultimately, tackling this global issue needs a big team effort. Policy changes, better environments for healthy living, and everyone sharing the responsibility, moving away from blaming individuals. The bottom line: it's complex, it's real, and there's hope. The evidence is clear. Obesity is a complex chronic disease. It's not a simple choice, and it's definitely not a moral failing. Understanding its intricate biological, environmental, and social roots is the very first step towards finding effective solutions. If you or someone you know is struggling, please reach out for professional medical guidance. Let's challenge the judgment, spread empathy, and push for policies that create healthier, fairer environments for everyone. Together, we can move towards a future where compassionate, evidence-based care is the standard.